So for those of you just joining us and some of you that have been on for a few, thank you. We're attending, what is this, meeting three, meeting four,
Yeah.
meeting three of the
Third
Livingston
meeting.
County ROSC. So thank you all. It's great to see your faces in 2022, right? Hard to believe. Okay, I'll stop talking. Go ahead, Barb.
Oh, no. Yeah. So like Nadia said, so my name's Barb Bromlevy, and I am a community health specialist here at Chestnut, and working on the, on the team for the Livingston ROSC Council. And just wanted to welcome everyone and say again, happy 2022. So getting used to saying that and writing it and all that kind of stuff. So hope everyone had a nice holiday and, starting to get back into the swing of things. It's, yeah. So anyway, so basically we, have the results from the needs assessment that was started back in October, and it's completed December 15th. That's when we all started looking at the data and analyzing that. And we're excited to share that information with you. So, want to thank you all for your time coming and joining the meeting today, and for your help, getting the survey out. Also, that was great. I think we touched a lot of different places, and we're very happy with the response that we did get. So with that, I just kind of want to, we obviously have a lot of information to go through, but would like time to introduce ourselves. And if you'd like to share a little something about yourself, great. If not, that's fine too. I'll just start, again, I pretty much already introduced myself, and little something I just want to share real quick is that, of course, the coldest week of the year, my furnace went out 2 nights ago, and thankfully they are installing it right now. So I apologize ahead of time if you hear anything in the background, because they're in the basement, but it's pretty loud. They've been kind of making these drilling sounds and all that kind of stuff, but apologize for that ahead of time. But I'm ready to get some heat. So lucky to have a fireplace, which I'm very close to right now. So that's, I'm not at my desk. I'm very close to my fireplace. So, okay, with that, I'm just going to go ahead and have Nadia and Frankie go ahead and introduce themselves, and then we'll just go from there. Thanks. So Nadia, do you want to go ahead and just introduce yourself, say something, and then
Sure.
Frankie?
Sure. My name's Nadia Kleekamp. I work at Chestnut Health Systems, and something interesting or something about myself. I tried to build a snowman earlier this week, and my snowman building skills are a little off. So work in progress. There wasn't really a lot of snow to do anything with though. So, okay, go ahead.
That's cool. Okay.
I am Frankie Ward. I'm a community health specialist. I'm a recovery specialist working on the Ford Livingston ROSC. I had a great holidays, but I'm actually really happy that it's over. And to get back to just like normal life after all of that. So yeah.
Okay. I'm just going to step in. We have a couple comments. Is everyone having a hard time hearing? I can hear, but it sounds like there are a couple people, or maybe Megan, I think. Can you hear okay right now or no, Megan?
Can you show us with emojis on your Zoom taskbar or put in the chat if you're having trouble hearing? You can try and work on that.
Yeah.
And
I'm not sure.
Check the volume on your computer. If you're using a headset, see if it's plugged in all the way. Sometimes it can do something like that. We'll keep troubleshooting tech. But Deb, would you like to start us off? Introduce yourself. Put you on the spot, sorry.
I'm Deb Howard. I'm the director of the United Way of Livingston County. I also run the Emergency Food and Shelter Program in Livingston County, and I am the co-president of the Homeless Coalition in Livingston County. And I love being a grandma.
Thank you for sharing. That's great. Awesome. Chris, would you like to go next?
Hi, I'm Chris Myers, and I'm the director at the Livingston County Mental Health Board and also the Livingston County Commission on Children and Youth. And we have a date to be moving our building. We are lucky enough to, we're a county department, and our small offices and health department will be moving into our new building in the front February 14th and 15th. So I'm excited about that.
Exciting. I'm sure the stress of moving can be a lot, but new facility, newer, that's great. Thank you. Denise, would you like to go next?
Hi, I'm Denise Backus. I work for Gateway Foundation and cover kind of the central Illinois territory, including Livingston County. So I started in August and moved over from Unity Point. So for those of you that I don't know, I'm excited to be joining the group and excited to be with Gateway. And something fun, let's see, I just got back from Florida, so I'm acclimating myself to the cold weather.
Quite a week to come back, right?
Yeah.
Thank you for
Right.
joining us. Sandra, I see you put the contact info in the chat, but would you like to verbally introduce yourself?
I am Sandra Beecher, and I work for Gateway Foundation as well. And Denise and I, we kind of tag team and work together in all of the territories. My role has kind of changed a little bit more on a national level, EAP. We also work a lot with the safety sensitive situations under the umbrella of Department of Transportation in all counties. So, and to tell a little bit about myself, I just got back from Florida as well. And I tell you, I have been freezing to death. We went from 80. And then on the way home, we went through 4 different seasons with a tornado, hail, rain, floods, snow, sleet, and now it's freezing cold. But we had a good time. So
Glad to hear it. Thanks, Sandra.
welcome,
Yeah.
everybody. Thank you for inviting me.
Teresa, would you like to go next?
Hi, I'm Teresa Beamer. I think I probably know almost everybody on the call. I am the Substance Use Program Director at IHR in Pontiac. So we serve Livingston County, and really we can serve anyone in the surrounding areas as well. You put me on the spot because I was having some problems with my computer hearing you guys. But the only thing I can say that I'm excited about right now is I've been watching Yellowstone and love it. And I'm almost through all 4 seasons since Friday. So that's what I've been doing in my free time.
I just started that also.
It is fantastic.
It is.
I need to start it because I've heard a lot about it.
I just can't quit watching it. It's awesome.
Right. It's good to see everybody.
Thanks, Teresa. All right, Dave.
Yeah, I'm Dave King. I'm the outreach manager for Carl Health, working under the SOAR 2 grant. I like farming, so I'm looking forward to spring when I can get out in the field again. There you go.
I learned something about you today, Dave. I had no idea. That's pretty sweet. Awesome. Thank you. Eric, you're on yeah, there you go. You're next.
Eric Mund. I'm the supervisor at the probation department here in Livingston County. I just got back from Arizona, and so I'm not liking the cold weather as much as the people that got back from Florida. So.
That's fair. All right. Well, thank you for joining us. Joe, would you like to go next?
Joe Vaughn with IHR, the executive director, and I'm looking forward to going to Florida next month.
I should get my tickets booked or something. I
great
don't know.
month to
Everybody's
go.
going warmer places. Well, thank you for joining us. Megan, would you like to go next?
Sure. Hi, I'm Megan DeMoss. I am a behavioral health navigator for OSF. Something about myself is I've worked in mental health for about 18 years now, both inpatient, outpatient, crisis. And I wish I was going to Florida, but I'm not.
Great. Thank you for joining us today.
I'll take
Patty-
you if you want to go.
Oh, there we go.
I'll get the bus ready.
You probably have that trip mapped out pretty easily, right, Sandra? Patty, I know you mentioned a greeting earlier, but not everybody was on. Would you like to introduce yourself again?
Yeah, hi. Thanks a lot. I distribute Narcan, help to distribute Narcan in Livingston County, and I recently have relocated to Leroy, Illinois.
Okay, great. Well, thank you for joining us today, Patty.
Yep, thanks.
Erin, are you back? Hello?
Hi, I'm here. I'm going to keep my camera off though, because I am still at home and in recovery. My name is Erin Fogarty. I'm with the Livingston County Health Department. I'm our Health Education and Marketing Director. And as it relates to this group, I facilitate our Narcan distribution and education and outreach for our communities in partnership with our wonderful partners over at IHR there. So hi everyone, and I guess my thing is I'm recovering from my second back surgery this year. So if you've had a hard time getting a hold of me, I'm fusing together in my back right now. So I'll be back to work on the 18th, or back in the office, I should say, on the 18th. So working from home. If you've had a hard time getting a hold of me, I apologize. Thanks everyone.
Welcome back, Erin. I hope healing is going well for you. Jim, would you like to introduce yourself, please?
Sure. Jim Wolford. I'm the Chief of Police in Pontiac. Been there since 2012. So I guess the only interesting thing is I'm looking forward, like Dave, to spring, and because I have a bunch of fishing lures that need used.
There we go. That's awesome. Well, thank you for joining us today, Jim. We appreciate it. Christine?
Well, dang, I just chatted, but I gotta go do the IYS at one of our junior highs. But I'm Christine McMillian. I work at IHR as well, and I'm the substance use prevention specialist. Sorry, my video is strange.
No, that's cool. I just saw the chat. I'm sorry. Well, good luck administering IYS. Right. Way to get that data. Awesome. Good
yes. Thank you, guys.
Let's see here. Brooke, would you like to go next?
Hi, I'm Brooke. I'm the Assistant Substance Use Clinical Supervisor at IHR. Something interesting about me, I have a 19-month-old son and a little brother on the way due in June.
Congratulations.
Congratulations.
Thank you.
Possible boys. Cool. Let's see here. Melissa, would you like to introduce yourself?
Yeah, I'm Melissa Ratliff. I also work at Carl Health in Champaign. Something interesting about me is I got a Google Hub for Christmas and bought myself a camera, and I've been having a lot of fun with that because I can talk to people walking by. So I'm that person, but yeah, it's been fun.
That's cool. Thanks for sharing. All right. And Rebecca, would you like to introduce yourself?
I think Becca put something in the chat because she had to run home.
Okay.
We just had a meeting and she had to run home. So I think she might be listening, but she might be driving or something and she's not able to talk. So Becca is, she used to be our drug court mentor, and then I kind of snagged her away from the team. And she's been at IHR a little over 2 years now. And so she does some recovery coaching, but she's doing more counseling and therapy, and she's actually getting ready to sit for CADC in about a month.
Awesome. Thanks for that update, Teresa. Welcome, Rebecca, as well. All right. I appreciate that. Sometimes you all know each other, or sometimes you don't. So it's always refreshing to share who we are, right? All right.
Yeah. Okay. So what I am going to just go over is, at our last meeting, we wanted to come up with a mission statement. So we had a couple to choose from, and based on the votes that came in, the mission statement is showing here on this slide, which I think, really is a great mission statement. So, so the Livingston County ROSC official mission statement is collaborating with stakeholders, people with lived experience, their families, and the community to empower, advocate, and support recovery by building a network of care to educate, reduce stigma, and improve connection for the community. So I think this covers, everything that we really, really need and want to do. So thanks for, sending your votes, and glad to have our mission statement there. So, so that's that. So now I just want to kind of go into the actual survey results that came in. And the survey did contain 26 questions, and each survey question fell into one or more of the categories. So, it would either be through based on awareness, access, advocacy, and opportunities for growth, or what were all covered within the 26 questions that were asked. So based on the results of the assessment, it will inform the strategic direction of our work in Livingston County, and the process of conducting the assessment. It lends itself to building trust with the community to ensure that we, have a successful ROSC initiative that we will be working over the next 5 years. And so I want to go ahead and hand it off to Frankie, our recovery specialist, and you can go.
Okay, so we had a total number of 202 responses. The demographics from the survey are right here. It was about a 60-40 split between the counties, which is kind of what we expected at the beginning, based on the sizes of the two counties. Livingston had the 61%, Ward had 37%. The majority of the participants were ages 40 to 64 at 53%, and there was 40% ages 18 to 39, and then there was a couple small percentages of different age groups. Okay, so the results of our survey offered a compelling picture of the realities of SUD and recovery in Livingston and Ford counties. The questions were geared towards learning public and provider awareness of SUD conditions, services, supports, gaps, and concerns in Livingston and Ford counties. Close to 90% of the participants believe that SUDs and mental health issues are a problem in the community, with more than 80% struggling or personally know someone who has or is struggling. Approximately 70% of participants, with about 12% that responded do not believe that existing services meet the current needs. This reinforces that there is awareness in the community about SUD and acknowledgement that the needs are not being met. Over 80% of the participants believe that there's stigma and loss of opportunity associated with SUDs and mental health issues. More than 60%, with more than 10% that responded do not believe that the information about SUDs and mental health is easily accessible or consistent. This continues to show that there are areas to work on when addressing SUD stigma in the community.
Okay. Do you want to go on, or do you want me to?
Oh, it's up to you.
Go for it.
No, you can. Okay, me. Okay. Over 60%, with more than 10% that responded do not believe prevention and wellness are prioritized in the community. And nearly 70% of participants believe that there are not activities for those in recovery, with more than 18% indicating they don't know. This shows that there's an opportunity to increase supports across the SUD continuum. The next. Approximately 65%, with more than 17% that responded do not believe barriers to treatment and recovery, like access to childcare, transportation, employment, and peer support, are addressed for those who need assistance. And close to 60% of participants say that there are no job placement services for those in recovery to gain employment, with more than 25% of them indicating they don't know. This shows the majority of participants do not believe barriers like these are being addressed for people in need, but this also shows that a big portion of them do not know. The farther along and more specific that the questions got, there were more don't know answers. There seems to be a basic knowledge that there are SUDs and mental health issues and needs are not being met, but how to address the needs and what is being offered is still pretty unknown.
So I just want to ask, right now, does anyone have any questions right now? Or, I mean, this is a lot of information, we all know. So, and we'll have time at the end also to, have a discussion here, but just want to, right now, anyone have any questions that you're burning to ask right now? All good? Well,
go ahead. Sorry.
Oh, go ahead, Nadia. What were you gonna?
Yeah. And also this is kind of a snapshot and it was across a wide gamut. So while we know as providers or people that are working in the field, we know what's what, sometimes it's to a community member who might not have direct need or experience, they may still not be aware of all that is available. And so it's not necessarily a knock on anything that is already in existence. It's just a understanding that maybe people don't know what they don't know, kind of a thing. So
Exactly. So
Can I ask a question?
Oh yeah.
Okay, Jim Wolford. The question is, in the beginning, it said that like 80% of the survey people indicated they were struggling or knew someone that was struggling. Is there a separation from that, or is that? I guess my question then is, who'd we survey?
Who did we survey?
Yeah. Mm-hmm.
Well, it was quite a variety. To go back, we all basically went into all the communities that, all the communities, all the towns within Livingston County, also Ford County, and went to all types of different businesses. Oh gosh, police departments. I mean, it was a gamut of places that we did go, and we explained the survey, and we asked if it was okay to put this information up so people could take it. I mean, even places like the local Casey's. I mean, all the towns had a Casey's, and that's a place where you definitely all kinds of people come in. So it was also obviously people that probably all of you took the survey as well. A lot of you probably did. So it's quite a variety. I mean, Nadia or Frankie, do you want to expand on that, or?
Sure, that's a great question. Obviously, 202 is low in relationship to the full percentage of the population in both counties. Given the timeline where we were trying to administer the surveys, we tried to at least provide opportunity for community members as a whole to be engaged with it. So there was some social media boosted posting to targeted like zip codes with targeted age groups, not to say everybody's on social media. So that was one specific way of trying to gain traction, and then utilizing sources that we had connections with. So the intent was to get a cross sector of folks, but it is good to identify or highlight that 80%, that is really high compared, but also to think about how prevalent is substance use disorder within the community, whether it is or is not diagnosed, or in the counties, if you will. So yeah, and we'll share this later as well. Coming later will be the executive summary. And then also, if you really want to sit with the full assessment, it turned out to be, 10 pages, and really talks to all the questions that were asked and all the themes that we had identified working through all of this data. We'd be happy to share that as well. And this is just the initial assessment. We'll be doing this on a yearly cycle to really gauge what strategies we've identified, how they're making a difference. So we would like to see, while the number of people that know someone with a substance use disorder or mental health issue may be the same, the awareness of available services should be increasing, or the knowledge of how to connect someone to those services or various recovery supports should also be increasing. So that would be hopeful of numbers we want to see change. But that's a great question, Jim. I'll stop talking.
Does that help answer, Jim? Did that help answer your question?
Yeah, thank you.
Is that good? Okay. And I mean, yeah, that question and the response, I mean, to me, my understanding, I think, and Nadia, you could probably speak to this, but I do believe, you know, 1 in 3 people know someone. I think it's 1 in 3. Am I right? Do you know that, Nadia? That you know, either you've experienced or you know someone that has experienced substance use disorder, or of course mental health issues too. So I mean, yeah, it's very prevalent. So just wanted to kind of add that, I guess. And let me, okay, so also at the end of the survey, you know, there was an area to put, you know, comments, and we did have 61 of the individuals that filled out this part of the survey. They took the time to provide their opinion in the form of comments, and in the actual survey assessment that, you know, was part of our deliverable, that was something that we met here. We included comments more than just the ones that we have here, but we did include comments throughout the assessment. And so as you can see there, we had 3 here. I can just read them real quick if you'd like. You know, one person had put, there are no resources for people in this area, no rehabs, no halfway houses, nothing. The community that you are trying to help are outcasts and are shunned in this area. And, you know, that comes to a lot of people still have a stigma around, as, you know, substance use disorder. And obviously that's one of our big things that we would love to work on and get more information out about this chronic illness. And you know, the one other person, comment 54, the community could benefit from additional resources to have more substance use as well as mental health resources to meet the needs of this county. And some of the service mentioned exist. However, there are a limited number of providers to meet such a substantial demand of this services, you know, in our community. And I guess that's not surprising. I mean, staffing is always a struggle, and especially it seems like in the environment we're living in right now. So, you know, that's something that it is what it is right now. And hopefully we can, you know, make that better. Let's see, the next comment was, being in a rural area, transportation is an issue. And I will say that was a big part. A lot of the comments hit on transportation. So that's a big issue that a lot of the people feel in the communities, as well as that access to appropriate level of support when needs are greater than what Livingston County, this person was obviously talking about Livingston County, has available. Facilities are limited and surrounding areas are overwhelmed too. So those were just a few of the comments. And like I said, there were quite a few people that did comment about problems with transportation in the communities. And I think that's everywhere. Okay, thanks. Sorry about that. So, okay. Any questions on the comments right now? And like I said, you know, there were 61 individuals that did take the time to comment, which was, you know, we really appreciate. So this is just a sample. Any questions right now or thoughts on that?
This is Sandra Beecher. I just want to add, I know I've been, you know, working in this arena for a long, long time. And even Nadia, when you and I worked together in the past, it's very, very difficult to get people to fill out these surveys. and even get these comments. So, I commend, your efforts in getting these surveys, and, hopefully they'll continue to fill them out, because you don't know what you don't know, but
Exactly.
again, stigma has always been really huge, and whether it's substance use or mental health. And it's hard to educate them too, as well, because, when you set up these educations, how do they get there? How do they have childcare? So, resources is definitely a plus, and education is a plus, and just continue to try to tear down those barriers and set up those services so that we can get out there, and so they know what they have available. So
No doubt. Exactly. Thank you. Thanks for that. Okay. So, the next steps for us is, and then after, we can have a discussion after this, but, just want to kind of go over the next steps and getting ready for the next month's meeting. So we will provide an executive summary of this assessment to all of you, by next week. Sometime next week, we'll get that emailed out to all of you. We need to start thinking about a SWOT analysis, which is, the strengths, weaknesses that we all see, you all see, opportunities that you think we have, and the threats. So it would be great if, for the next meeting, we would go over all of that. And it would be great if everyone could start thinking about that. Just jot down some thoughts, ideas towards that. And then, we can discuss that at the next meeting. And then that can lead us towards our strategic plan, for the community, because that's what we need to do, and then we can hopefully start getting out there and working on things that are needed. Yeah. So at this point, I just want to open it up. And like I said, we just went over a ton of information. We'll send a summary, of course, but would love to hear some of your thoughts, questions you have right now. We have some time to do that. So anyone that wants to jump in, go for it.
Yeah, I just wanted to ask, so right now in Pontiac, people who are on MAR for opiate use disorder, Subutex or Suboxone or that, they have to go to Gibson City or Bloomington, and because they're not clients in IHR, they have to you have to figure out your own transportation, and through doing that, it has to be approved through your insurance, and some insurances, most of the insurances don't cover opiate use disorder. So is there anything that can be done about getting people gas cards if they are in a treatment program outside of the county they live in?
Good question.
I can take it.
Okay, great.
So I think, there's potential, but we have to think through what's going to be sustainable and the capacity on what we can offer. So maybe there could be an option. I think that falls into the strategic plan about how do we address transportation for folks who need it and have to go a distance, and what is a plan that is not just one gas card, because we all know one gas card maybe is going to fill half a tank, right? So what is going to be sustainable for the client to get to where they need to go consistently, but then also be offered in a equitable way to anybody who might need it. And then what does that look like? So it's not a no, I think we have to figure it out, and what that would look like for the community, and how do you go about doing that, and who would house it, and how do you apply, or I think some of the logistics need to be figured out, but there's an opportunity there. to meet that need. It'll take a little bit of time to plan well.
And
So, good
that's,
question.
yeah, and I think that will be a big part of our strategic plan, because obviously that is needed. I'm sure you've all heard or known. I believe that the age group 18 to 45, I believe, leading cause of death has now surpassed, car accidents, of overdoses, mainly fentanyl overdoses.
Yeah, I just want to comment on that. The insurance company said that they don't provide transportation because it's not a life or death situation. And for a lot of people it is. So I like to disagree with that.
To me, that's very frustrating. And I don't know, and Nadia or anybody here might be able to talk to that, because insurance companies are a whole nother ballgame. I don't know if that's something I would hope. Yeah.
This is Dave King, just to jump in.
Yeah.
Transportation generally is not covered by, commercial providers, but if they're a Medicaid recipient, there may be some opportunity, for travel reimbursement or transportation reimbursement. The other thing I was wondering is that depending on who the MAR provider is in Gibson City, for instance, we've had some participate through the ECHO project, at Carl for MAR. One is Kate Ostman. She's a provider at Gibson Area Hospital. Connie, I always forget her last name. It's either Katrin or Katrin, but she's a provider in Melbourne who's a MAR provider for us as well. This went through the ECHO program. And so there may be some telehealth options is what I'm wondering, depending on, the client's, technical capability, but that would at least give them some consultation, available without having to travel. And I will raise this question with our ECHO group just to see what feedback they can provide on this then as well.
Yeah, I just want to add that Dr. Osman in Gibson City, she does work with the clients and help them get reimbursement through the insurance. And that's awesome. And also the telehealth, thank God, is a lot more available now than it used to be. So things have been changing there. That's thank goodness for that. But, there's still a need out there, just to be able to make it to the appointments.
Yeah, one of the reasons why we're looking at, grants for a mobile unit, where that can be strictly substance use disorder focused to be able to provide that kind of stuff. But the problem is it can't be in every community, throughout a large geography. But that's something we're looking at. And like I said, I'll talk to our group and provide information back to Nadia or Barb or somebody to distribute.
Great.
One thing I'll add as well, at Gateway, we are able to help provide transportation for commercial insurance with the amount of Medicaid that we also get. It's not something we can support across the board, but for commercial, we can provide transportation, and we are still doing virtual treatment as well.
Oh,
so from PHP or from IOP outpatient level, we're still doing virtual as well for people that do have transportation issues.
That's great. Thanks.
To be able to help with the rural areas, to at least get them some services.
Great. That's good to know. I'm just kind of taking some notes here. Yeah.
Other thoughts or feedback or other items that you'd like to discuss, maybe specific to the assessment data, or even one comment I wanted to make with the SWOT analysis, as that would be something to work on for y'all in the next month, to think through what the strengths, weaknesses, opportunities, and threats. Think when you think strengths and weaknesses, what do we have going for us internally as a council? And then opportunities and threats. So think about that more as an external. What opportunities are existing in Livingston County? What threats do we face outside as well? And it could be even just environmental, if that's something, is to give you an example. So Any other questions?
Whoever it was that spoke on earlier, the Livingston County Coalition for the Homeless, I was wondering if you could email that information, and then is any information on any resources for Livingston County, if you can email it to pontiacaware@gmail.com. I'm just putting all the information on the Pontiac Aware Facebook page, just trying to get it out there so people know what resources are available, because sometimes it's just not even knowing that, you know, the resources are out there.
Exactly. That's true.
We can help facilitate that. I know there's a couple, there's a great resource directory that is housed in Livingston County. We can push that out, but yeah, definitely any other additional information that, you know, I feel like that's the theme for the day. Folks don't know what they don't know. So how do we best connect them? So yeah, good suggestion.
Okay. And Deb, what email address were you asking about?
The one that Pontiac Aware just said. I'm with the Homeless Coalition, so I wanted to answer, but I didn't write it down fast enough.
Yeah, great. Patty, could you go over that again, please?
I just shared it.
Oh, awesome.
Thank you.
It's just pontiacaware@gmail.com. Thank you, everybody. I appreciate it.
Nadia, you can send that resource directory that Christine, that we did with probation, to anybody on the email list.
We'll just do that. Deb,
Yeah, I would say that's actually what I was going to do.
Yeah, I'd like to have that.
That'd be easier.
Absolutely.
Let's do it.
Okay.
That's one thing too, is just to be able to share what we know, right? So
exactly,
more the merrier. And as you, if you want that full assessment documentation, one of the asks of one of the state's grant deliverables was also to do some resource mapping. And really, we reformatted what was already created for Livingston. So
Very
it's
true.
pretty much the similar. So that is huge to even have that available, because not all counties are organized like that. So that is very good. So let's get that networking and shared for sure. So good.
Okay. Yep. We'll definitely do that. And then I just want to, I'm everybody, you still can ask questions, but I want to jump in here too. And it would also be great if, I don't know, obviously I'm sure you've already done this, but if there's any others that you think would like to, be involved and invited to the next meeting, just let me know, let Nadia know, Frankie, whoever, just email us that information, I guess. Or you could give them our information to contact us. And it would be great to get, more people with lived experience, would be great to add on to here. So, I just wanted to throw that out there. So and then, go ahead with any other comments or questions. I know our next, I don't know if that's up yet, but our next slide has our contact information. Oh yeah, it looks like it's up there. So
I just wanted to add that I've spoken with a few people who would like to make it to the meetings, but they work during the day. So I just told them to watch the video on YouTube and then email one of you guys if they have any questions or comments.
Most definitely. And if they, and make sure, let anybody know, and they can email us, and then we'll have their email address to add so they can be on the list and receive information as well.
Okay, thank you. Happy New Year.
Thank
you. You too, Patty. Thank you.
And that's also something, sorry, Chris, go ahead. I interrupted.
Ford County does have a 708 board, but I'm not sure if they have any paid staff or if it's just the board members. I reached out to them several years ago because we were just trying to do that for our state association. But I'll see what else I can find out, if there's anyone from that board or if they've got any staff that would like to sit in also.
That would be great, Chris. Thank you.
Thanks. Yes. And in specific to Ford County too, we are working to partner. They have an established opioid coalition. So they have similar stakeholders that we both would like to share. So we will hopefully be sharing ROSC data at their next coalition meeting. That's, I think, towards the end of this month as well. So that'd be great, Chris, if we can get an individual's names if that person exists. And also speaking to participation in the ROSC Council, recognizing that finding a time that's going to work for everyone is not even feasible. But hopefully, the recordings will be better because they've been terrible the last 2 times because of some tech issues on my end. So I apologize. So hopefully today, the recording will be nice and crisp and you can watch it later. And then also too, as we continue to work through the strategic plan, based on what goals we set, strategies to work on those goals, there may be potential to develop a subcommittee that has more specific focus. And those don't necessarily meet during the workday. Those could be in the evening or whatever is needed. So be mindful of that as we continue to think about who else can join the council, that even if they can't physically or virtually participate when the meeting is live, their participation is wanted.
Exactly. Yeah. Great. Any other questions, comments? Think we're all good?
We'll be sending you a lot of great information coming. And if you want a copy of the full report, we'd be happy to share it with you. If you have some other feedback and want to sit with it, we're all ears or all eyes.
Yeah, just let us know, email us, whatever, and we can get that sent to you. And like Nadia had said, there's resource mapping in that, and yeah, I mean, it's a lot. It's like I don't remember how many pages, so it is a lot to go through, but if anyone's interested in that, we can get that to you as well. So I guess just to reiterate, again, thank you for your time, everyone. I know I'm definitely looking forward to our next steps and really trying to get more people, educated with what's available. Reducing stigma, et cetera, is huge. I mean, that's a big thing, obviously. And just, working on the next steps, like the analysis, the SWOT analysis, definitely that will be a big part of our next meeting. So it would be great just if you have time to jot down some ideas, information for the next meeting. So that would be great. And like Nadia said, we'll get a lot of good information out to you. So yeah, Happy New Year, everyone. And if there's no other questions, hope you all have a good rest of your day.
Thank you, everybody.
Thanks, everyone.
Thank you.
Bye. Take care.
Bye.
Bye-bye.